Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What's new with MedStar Montgomery Medical Center? Find out more right now. My guest this evening is Nathan Barbo, Vice President of Operations at MedStar Montgomery Medical Center. Nathan, welcome to Housecall.
Great to be with you this evening.
So briefly, tell our viewers about your professional background.
Yeah, I appreciate that. So I have the privilege of serving as the Vice President of Operations here at MedStar Montgomery Medical Center. And I've been here about 4 years thus far, almost 10 years total at MedStar Health. And in my role, I get to oversee a number of different areas that I'm very fortunate to work with. A couple of them are the traditional ones you think about for a vice president of operations, such as food and nutrition or facilities or the security department. I also have the opportunity to work with clinical support areas, such as laboratory, pharmacy, imaging, rehab, respiratory therapy. And then the third hat I get to wear is working with our physician practices. A lot of specialty areas that we'll talk about tonight, I'm sure, some exciting expansions and recruitments. And I get to support our outpatient practices and also how they work here in the hospital setting.
How exciting. You wear many hats, don't you?
I do. It's a fun job. You know, when people ask me what's a normal day like, I chuckle because it's different every day. And that's part of the exciting part. Keeps it fun, keeps it fresh. You know, we spend too much time working to not enjoy what we do. And I'm very fortunate to get to do it here at MedStar Montgomery.
Now, of course, for many years, MedStar Montgomery Medical Center was known as Montgomery General Hospital.
Mm-hmm.
And then they ultimately partnered with MedStar.
Mm-hmm.
Tell our viewers what that transition was like and what are the many advantages working with MedStar.
Yeah, most definitely happy to do that. Very long history here in the community as Montgomery General. The hospital was actually founded about 100 years ago here in the community. We just celebrated our 100th anniversary. And so about 12 years ago, we joined the MedStar Health System as the hospital. And tons of different benefits come along with that as being part of a large system. But also the piece that I love is that we've kept our local personality. We've stayed true to who we are and who made us successful for that first 90 or so years. And so joining the MedStar system, there were a couple immediate tangible things that we saw. There was a new emergency department that was built. There was a vertical expansion on the building. We added a couple different floors for different physician practice areas. And obviously our colors and our logo changed a little bit. But I'm very proud that we've stayed true to who we are as a community hospital. And there's so many people here in the community. There's so many providers, so many patients that have been born here, came to work here, and that truly love this hospital. And that's what really makes it special. I've only been here for about 4 years myself, but it's amazing how many people work here for many, many years. And every time we celebrate our service awards, which is where we recognize 5, 10, 15 different years of service, I'm incredibly impressed and humbled when we have people at 40, 45, even 50 years of service. And I think that shows that this is somewhere where people can see themselves, not just for a job. This is a career and this is their passion. And you don't get that at every institution. And I think that's a great opportunity here at MedStar Montgomery. It's the best of both worlds. You know, we get to be part of a large institution. We're part of MedStar Health, which is a 30,000 individual organization. But also you can stay very personable. You can be cared for by your neighbors here in the Olney community if you come to our hospital.
Now, I've had the pleasure over the years to 4 different times serve as a speaker on gastroenterology topics for the medical staff at the hospital. To explain to our viewers, Grand Rounds is a weekly event that occurs where doctors come in to get an update lecture on different topics. And it's been really abundantly clear to me over the years that MedStar Montgomery General Hospital is much more than just the hospital, but it's actually the epicenter of what's an emerging healthcare campus.
Mm-hmm.
So tell our viewers, what are some of the other buildings that are surrounding your hospital?
Yeah, definitely. And I'm glad you're able to present, and hopefully we'll get you back here to do another grand round for gastroenterology. We have continued with grand rounds even in this new COVID world. We've moved virtual as everyone else has, and we're on
Sure.
Zoom just like everyone else. So if you look at the hospital campus, it's definitely changed over the years, and it's fun to look back at the history and look at some of the pictures and what the footprint used to look like here and how we've added different physician office buildings, expanded the hospital campus, and even built additional suites and different functionalities within the same footprint. And I'll give you a couple of recent examples. We actually opened up a new outpatient oncology center in 2019. And we're incredibly proud of this center, not just because it's a fancy new clinic, but it also co-locates all of our oncology care in one part of campus. And unfortunately, with some of the horrible realities that our cancer patients have to go through, the more we can make it easier for them to facilitate their care, the better. And so if we're able to do that for their clinic, for their infusion center, for their radiation treatments, that's really the type of collaborative care that we're looking to build. The other recent one I really like to highlight is our outpatient imaging for breast health and mammography. And we opened this in 2019 as well. And so this is a brand new breast health mammography suite here with the latest and greatest equipment, but also the most compassionate and most knowledgeable and competent team of caregivers, staff, physicians that get to support that area. And when you look at a hospital our size, oftentimes you're not able to pull together all the multidisciplinary teammates that you need, but I'm incredibly proud that we've assembled an all-star team of physicians, nurse practitioners, staff members, imaging technologists, surgical support folks that really bring the best knowledge and expertise here to Olney. And so instead of having to go up to Baltimore or down to DC, you can get that type of care right here in your backyard in Olney.
But you bring up a good point. On the one hand, you've assembled a superb healthcare campus for coordinated care right there in Olney. But of course, there are some patients that may require higher level tertiary medical center care. So tell our viewers about the advantages of MedStar and some of the other hospitals that are part of your network that allow a streamlined referral pattern.
Great question. Great question. So if you look at the MedStar health system, we are one inpatient hospital out of 10 in the whole system across the DMV area. So there's 4 hospitals in Baltimore, there's 3 right down in Washington, D.C., and then there's 3 inpatient hospitals in the surrounding Maryland areas. We are actually the only hospital in Montgomery County within the MedStar footprint, which makes us strategically aligned to help support patients in that middle area. But also, if they need to go to another tertiary level of care, like you mentioned, David, we can send you down to DC and work with our partners there. Or we can send you up to Baltimore if one of our facilities there has the type of care that you need that we don't provide on site. And those are some of the things that we try to make as streamlined as possible because that's where the best patient care is provided. And I'll give you an example through our cardiology service line. And unfortunately, if you think about going to an emergency department and it might take you a while to get in, and then you get seen by the physician, and then you realize, you need some testing. Sometimes that can take hours at certain healthcare organizations, but we're incredibly proud of how fast our ED is. But unfortunately, if you're coming in with chest pain, if you're coming in with some type of cardiac event, we are very active with our helicopter here that can fly patients down to Washington, D.C. We have the MedStar Heart and Vascular Institute. And so we can get somebody through our emergency department, whether they walk in or come in by ambulance, assess the issue, talk to our partners down in Washington, D.C., and we can fly individuals down there in roughly 10 minutes on a helicopter, which gets you fast tracked in for that type of cardiac care. When you're talking about stroke and different things like that, not just minutes, but seconds make a big difference. And so we're proud that we can do that for cardiology, different types of neurology circumstances, orthopedic trauma. There's all sorts of things that we can handle very well locally. But like you mentioned, if there's a certain type of procedure or condition that we have experts around the system that we'd like to utilize, we're able to fast track that within the system because it's all one medical record. It's all everyone wearing the same MedStar colors, working for the same goal.
How exciting. Briefly, of the 10 hospitals, what are the hospitals located in the DMV?
Yeah, so starting in the Baltimore region, there's 4 up in Baltimore City. So MedStar Harbor Hospital is on the south side of the city. MedStar Franklin Square Medical Center is kind of the northeast side of Baltimore. And then right within the city, MedStar Union Memorial Hospital and MedStar Good Samaritan Hospital round out the 4. So that's the northern part of the system. Right in Washington, D.C., there's the MedStar Washington Hospital Center, which is our very large hospital. It's roughly 900 beds, level 1 trauma center, burn center, can take care of just about anything possible you can imagine. Also in Washington, D.C., we have MedStar Georgetown Hospital. So MedStar Georgetown University Hospital joined the MedStar system a number of years ago and is an amazing research engine and also a teaching hospital, which supplies huge numbers of medical students and fellowship and residency opportunities. So we're very proud of that partnership and working with MedStar Health across with all these different students and the next generation of healthcare leaders. And then also in Washington, D.C., MedStar National Rehabilitation Hospital is there. So that's very close to MedStar Washington Hospital Center. It's our inpatient rehabilitation hospital, which obviously has many, many outpatient sites across the region. I think they're over 50 at this point, but they do have a home-based hub there at the inpatient center in Washington, D.C. And then the Maryland hospitals to round out hospitals 8, 9, and 10. So we are in Montgomery County here in Olney. And then MedStar Southern Maryland Hospital is in Clinton, Maryland, in Prince George's County. And then down in St. Mary's County, we have MedStar St. Mary's Hospital down in Leonardtown. So pretty wide geographic distribution. We're very proud that overall MedStar takes care of roughly 1 in 5 patients in the region. So about 20% of the patients here are seen by MedStar. The piece I'd really like to add to talk about COVID for just a second is that during COVID, we've actually seen that number go up to 1 in 4 or even larger than that, which I think really speaks to us being looked at as a trusted leader for healthcare. You know, that's really who we try to be. That's our vision, to be the trusted leader for caring for people and advancing health. And I think when times really get tough, like they have during COVID, that's when we're proud that people are looking to us.
We've got 1 minute before we pause for the break. Briefly, there's been reports around the country that many patients with fear of COVID-19 have avoided going to the emergency room. Has that been the experience throughout the MedStar hospital network?
Yeah, that's a great question. And yes, overall, we have seen patients stay away from emergency departments and stay away from medical care in general. And I heard a new term a little while ago called medical distancing, you know, not just physical distancing or social distancing, but medical distancing, which makes sense when you think about it, but it's unfortunate because all those other medical conditions don't stop just because COVID is there. And you're a gastroenterologist, unfortunately, you might be seeing people coming in with later stage colon cancer disease, or we saw this a lot of times with cardiac conditions. Some individuals were having heart attacks at home, but afraid to come to the emergency department, and so they were staying away. And the balance is trying to include everyone in their care in a way that makes them feel safe. And so we try to do that, coming to the hospital campus, going to our doctor's offices. We've made people feel safe by spacing out appointments, doing advanced cleaning, putting up those plexiglass shields to try to provide additional barriers. But we're doing all those things to keep people safe because we know that regular medical care needs to continue, not just when you're brought to an emergency department. And honestly, I felt safer coming into work over the past year than I did out in general public or going to the grocery store. We've got tons of hand sanitizer, the right PPE, and people know what they're doing here in the hospital setting.
Excellent, excellent. We're going to pause briefly for a public service announcement. More with my guest, Nathan Barbo, Vice President of Operations, MedStar Montgomery Medical Center. We'll be right back.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3. Dad! You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
We're back. My guest this evening is Nathan Barbo, Vice President of Operations at MedStar Montgomery Medical Center. Nathan, when we paused for the break, we were discussing the implications and challenges of COVID-19. So let's focus specifically on your hospital. What was it like when you first were notified of the wave of patients, the tidal wave that was anticipated? What kind of contingency planning did you do?
Yeah, it's interesting to think back, especially at this time, because it's been almost exactly a year since the first COVID positive patient came into Maryland. If you think back to March of 2020, we've come since then. But, thinking about our response at MedStar Montgomery Medical Center and MedStar Health overall, it began well before March. When that first patient showed up, we were ready and prepared. And honestly, we were a little excited to see what would happen for our first patient because we'd been practicing, we'd done drills, all of our teams were ready. And so this planning began at the towards the end of 2019. And so then we were ready when this did come up because we'd seen what happened internationally and we'd seen some of the horror stories, but also knowledge and information was coming so quickly, we had to communicate with our teams across the board. And that was throughout the entire MedStar Health organization and especially local. And part of what I'm very proud of is that we went back to the basics here at MedStar Montgomery. We focused on direct communication with our associates. And we always do rounds, whether you're a leader on the executive team, a department leader, but we really focused on asking for questions and feedback so that we could provide the right type of information. And that was incredibly hard at the beginning when knowledge was changing so quickly in terms of what type of PPE was best, or how is the virus transmitted, or what type of tests should we run, how often should we run. And so the challenge was communicating as promptly as we possibly could, but also having to go back sometimes when the knowledge changed within a couple days. And so the way we were able to do that was to really have that trust of our associates that we were providing them with everything they needed. And sometimes those resources were a listening ear, and we just needed to hear them out about what they were scared about, what they were proud about. But other times it was direct PPE supplies, or what's the right protocol for handling a surgery patient that might have COVID. And so all these different things we'd never encountered before, we had to develop new processes. And I'm incredibly thankful when I think about what we did locally, but also what we centralized across the MedStar Health system. And part of that allowed us to focus on the very hyper-local decisions as opposed to things that affected all 10 hospitals and all 30,000 individuals across our system. So policies like masking or policies like visitors, we didn't have to come up with something different at our hospital, which allowed us to focus on the specifics that were more pertinent to our local community. And so I think about those first days in early March, and at first we thought we had a good streak going. We didn't have any positive patients, and we were thinking, how long can we keep this up? And then it was only a matter of time before we went up to our first patient, and then 5, and then 10. And at one point, our hospital, which is about 125 beds total, we had over 60 COVID positive patients in the hospital one day. And that was our peak back in May. So over half the hospital was COVID positive. And it was amazing to see the teamwork of our clinicians, our nurses, our staff, our technicians across the board. Everybody really jumped in. And the scary thing at that point is we didn't know that was our peak. And so you don't know what the next day is going to hold. But every day that those numbers go down a little bit, which we're seeing today, gives you a little bit of optimism. And there's different waves as we've seen over the last year. And you can do anything for a short amount of time on adrenaline. It's exciting, it's different. But when things have been sustained as long as they have, this is really challenging. And that's where we've focused keenly on our resiliency amongst our staff, trying to take care of our most valuable assets, which are our people. And that's where I couldn't be more happy to be proud of the MedStar Health organization, because we've taken care of people the entire way. And we did not lay off a single person during this entire pandemic. We provided advanced paid time off to individuals. We actually started an employee assistance fund that was kickstarted by our executive team in the amount of $3 million to provide financial assistance to individuals, which did not need to be paid back. So there was a committee that looked at every single application that came through, because not only did this affect our workers, on the personal basis, it affected their families. And I don't think anybody has been unaffected by COVID over the last year. At first, maybe it wasn't somebody in your family, it wasn't somebody in your friend circle, but as we've unfortunately and tragically lost over 500,000 individuals with millions more being sick, it's impossible to not be touched. And if you care about the 8 hours a day that somebody's working with you, you better care about the 16 hours a day that they're not with you. And you have to be at least cognizant and try to take care of their personal lives and their families.
It's a very informed view towards your staff. Very impressive. Many hospitals are describing that, as you said, after the initial adrenaline rush subsided, and there was this unrelenting stress of dealing with wave after wave of patients, that many of the staff, doctors, nurses, support staff, a year out are now facing post-traumatic stress syndrome.
Mm-hmm.
Has that been your experience with the staff at MedStar Montgomery Medical Center? And have you provided any special counseling to assist them during this difficult time?
Yeah, that's a great question. And yes, I think to some degree, we're all experiencing that, whether you're in the rooms, whether you're in a support environment, whether your loved one works in a healthcare institution. And, I think we've done a number of amazing things at MedStar Health to try to take care of some of those basic needs so that folks can focus on being resilient and trying to come back to work as best they can. And I think about some of the lower level things that are incredibly important, like transportation. And MedStar Health provided Uber rides and Lyft for associates that were impacted by public transportation, or maybe their own, vehicle for financial reasons wasn't viable. So we provided that. We also provided hotel stays for individuals that tested positive in case they didn't feel comfortable going back to their families. And this is allowing folks, not that it totally takes the place of resiliency and negates the negative impacts of COVID, but that allows them to focus on the good work that they're doing and also not to have to worry about their family and their loved ones as much. And we hope that we can provide those types of resiliency opportunities so that folks can come back to the meaningful work, which is why they got into healthcare in the first place. And, we are really focusing on wellness of our associates and our medical staff. We have every year an internal giving campaign where we run through philanthropy called the Power to Heal. And this year, the campaign was geared towards health and wellness of our employees. And so we raised a number of dollars here locally to start looking at things like wellness and recharge rooms, whether it be snacks or quiet spaces, somewhere to get off your unit and have a little bit of downtime. Also looking at wellness opportunities, whether it be food, whether it be what I call the warm and fuzzies oftentimes, where we can get those positive moments that rejuvenate you. Because sometimes it's not just time away, sometimes it's the amount of energy and the things that give you that lift. And I can think of countless examples over the last year where we had some incredibly supportive and uplifting discharges of patients. Those triumphant stories where patients were in our ICU for 50 days and then walked out the door. I mean, that's the kind of thing gives me goosebumps right now just thinking about it. But when you see a clap line of 100 associates and that person meeting their loved one at the door, that's the kind of stuff that makes you want to come back and run towards that fire, not away from it. And that's not easy to do day after day. And I think that's why you started to see those signs for healthcare heroes popping up all over. Obviously I'm biased, and I'm sure you are too, but I think we've been heroes all the time in healthcare, whether you're wearing a white lab coat or you're wearing scrubs or sometimes wearing a suit. But at the same point, I think this opened our countries and the world's eyes to the amazing work that our frontline healthcare workers are doing every single day. And that's the kind of thing that gives you resilience in order to come back and hopefully remind you about why you're passionate about the work that you're doing.
Well said. So let's shift gears to discuss COVID-19 vaccinations. First of all, has it been offered to your entire staff?
Yes, it has. Yeah, we rolled out vaccination in the middle of November. And so amazing team effort across so many different parts of our organization to stand that up. So yes, we have offered vaccination to all of our associates. At first, it was limited as we only had limited supply, and we had to work through the different risk areas such as the ICU or urgent care or the emergency department. But once we had sufficient supply, then we were really trying to encourage all of our associates when available to get the vaccine. And it's amazing to see the team from pharmacy and nursing and IT and everybody stand up these vaccination centers, which is on top of our normal pandemic response. This is on top of surging COVID units and incredibly high volumes of very sick, acutely ill patients. And we're doing this on top of the normal 9 to 5. So yes, we've offered it to everybody, and we're increasingly trying to push more and more positive stories, but also education so that encourages all of our associates to get the vaccine.
Let's go on to discuss then the Olney community and of course Montgomery County in general. has your hospital been involved in vaccination programs for the general public?
Yes, we have. So I think towards the end of January, we started rolling out community vaccination. As we were able to get more supply, then we rolled out community vaccination, starting with the risk tiers from the state, and then obviously prioritization for age and different medical conditions. And I think one of the things that makes Montgomery County unique is our large elderly population. And as age has been one of the biggest risk stratifiers for who qualifies for the vaccine, that means there's a lot of eligible people in Montgomery County. And the challenge is there's so many eligible, but the supply has been limited up to this point. And you can't turn on the news or listen to the radio without hearing stories, hopefully some of them good, but also some bad stories about the vaccine rollout. But regardless, I can tell you from our hospital and the other hospital leaders that I talk to around the county, and also my colleagues in the industry, everybody's trying as hard as they possibly can. And this is a new complex setup. The medications themselves, when you're talking about ultra cold freezers, negative 100 degrees, they only can be shelf stable for a certain number of hours without being wasted. It's an incredibly complex Tetris puzzle that you're trying to fit together and find the patients to give it to. So it might not be happening as fast as we all want it to, but eventually we're getting to the point where everybody will be offered a vaccine, and I'm very happy about that.
Are the vaccinations you're offering to the public exclusive to the hospital campus, or are you doing any sort of outreach vans or anything else to provide on-site vaccinations?
Yeah, great question. For the most part here at MedStar Montgomery, we have been administering the vaccine locally. We haven't specifically gone into any communities yet to do it here around our geography. However, in Baltimore, MedStar Harbor Hospital has a mobile health clinic that has been rolled out across different areas at MedStar, especially looking at some of our underserved communities like the Cherry Hill community. We're also looking at some of our population's assisted living facilities where it's tougher for them to get to. But I am very proud that we, the MedStar Health System, partnered with Leisure World just down the street from us here, and we're able to vaccinate thousands of their residents in partnership with them and with the state. And so that was done at our medical center on the Leisure World campus, but we help support those operations. And moving forward, these mass vaccination sites are standing up, which is fantastic because these sites can give 3,000, 4,000, 5,000 plus vaccines in one day, which is definitely more than the capacity that each hospital could give. However, hospitals and health systems are very well positioned to help take care of those special populations, whether it be for medical conditions, whether it be our local communities that we know very closely. And so that's where we're really trying to focus our attention in the weeks and months ahead.
Nathan, we are out of time. I want to thank Nathan Barbo, Vice President of Operations at MedStar Montgomery Medical Center, for a superb, informative interview. I want to thank my team at the studio for their ongoing camaraderie and teamwork to get this program produced. And most important, I want to thank you, the viewer at home, for inviting us in to share this program with you. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next program, my guest will be Dr. Shannon Pryor, President of the Maryland Medical Society, and we'll be discussing the challenges of healthcare in the state of Maryland. It's going to be a fascinating show. See you then next time for another edition of Housecall. Good evening.